Artificial intelligence and the future of healthcare is our episode topic. My guest is Paul Osborne, Managing Director and leader of BRG's Healthcare Performance Improvement Practice. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's Healthcare Performance Improvement Practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Paul, thank you so much for joining us today.
Glad to be here.
Before we get into our episode topic, can you share a little bit about yourself with our listeners?
I am a managing director with Healthcare Performance Improvement Practice. Actually started the practice back in 2011, and I've been working with health systems for my whole career, really, with performance improvement, going back to the mid-90s after I got out of grad school with a couple different firms, but came over to BRG in 2011 and got an opportunity to start a practice from scratch and took that opportunity, and it's been great. So I've, worked in, hundreds of hospitals over the years. Haven't kept count, but always been around performance improvement.
Excellent. Our topic today is AI and the future of healthcare. Now, BRG recently released a report under the same name. The link is available for download in this episode's description. Can you talk about why BRG invested in creating this analysis?
Yeah, AI has been a very hot topic for a few years now, and in healthcare, of course, also. And there's, a lot of uses for AI to help, from my perspective, providers, help them improve both clinically and administratively. So there's a lot of talk in this space, and we just thought it would be important to really dive into it and help explain what AI is, how it's currently being used in healthcare. And it's broader than just providers, but from my perspective, of course, I work with providers, so I'm interested in that area and where it's going into the future. So there's a lot of hype. Some of it is very warranted and some maybe not so much. But there's, also a lot of concerns around how it will be used. So we just thought it would be a really good time to address that and get this paper out.
What were the key findings of the report?
We probably interviewed, 150 or so people as part of this and in the healthcare industry and experts. And about 75% of them believe that AI-related technologies will be widely used over the next few years in their organizations. So that was obviously a big finding, not too surprising, but that was a major finding. And half of these providers and pharma, they say that their main concerns are around accuracy, data privacy, data integrity. However, less than half of the people felt that or even had an active kind of governance structure within their organizations where they were really monitoring regulations around it. It's been a big topic for investors too. Investors have spent over $31 billion in healthcare AI related technologies between 2019 and 2022. And that's expected to increase greatly in the values of those, the market value for those healthcare organizations moving forward. So those were some of the key findings.
You were recently quoted cautioning hospital and health system leaders to avoid getting caught up in the AI hype and instead strategically target the specific needs that they want to address as an organization. Can you talk more about this?
Sure. Some of this was from our own experience in developing AI tools for our clients. Going back, maybe 4 or 5 years ago, in BRG, we had acquired a small AI firm. And they were working with some of the other practices in BRG, and we thought it would be, hey, great opportunity. Let's find some uses for hospital clients. We dove into it, spent a lot of time, a lot of hours trying to develop some solutions and some tools. And it really didn't go anywhere outside of wasting a lot of time. And I think the problem that we found is we didn't really define the problem that we were trying to solve. And without a good, well-defined problem, it's hard to show the programmers, what to do. So we kind of scrapped that after, wasting some time on that. And then didn't do much. Fast forward till about 2022. And at that point, we were working with one of our standard PI projects in the medical group. And we identified a discrete problem that has always been a problem with medical groups. That was around, in this case, around no-shows. And we said, hey, we got the data. What if we can help predict what patients aren't going to show up for their appointments and then help mitigate the impact of those no-shows? We were able to really define it carefully and had the data for it, and we're able to develop a solution around that. Another thing is we've had clients that have, been out on the leading edge in AI tools. And one of our clients developed quite a few tools around AI and automation. And then that firm they were using went out of business. So they were now stuck with all these applications that they couldn't support anymore. And they were used to do some pretty significant, important processes. So we just think it's important to really understand what's the best way to use AI automation in the organizations before you get started.
You mentioned this a little bit earlier when you were just talking about the work around scheduling, but it makes me think of an earlier episode in season 2, episode 16. Doctors Scott Wolf and Dustin Fowler, they talked about effective ambulatory strategies to decrease hospital census. And one of their focuses was around improving ambulatory access through
Mm.
innovative scheduling services. So can we dig into that a little bit further? And maybe you can talk about that and what's available?
Sure. One of the processes around this, the no-show tool that I briefly discussed, what this does, it helps patients get quicker access to their outpatient doctor visits. And that's very important, right? You want them to get access when they need it. Instead of having to wait with maybe multiple weeks for a wait list to get an appointment, you can get them in very quick. This tool, this application that we developed for one of our clients, it's opened up over 2,000 new appointments a month for the medical group. Yes, that's pretty significant. Of those, about a third of them are actually getting used, which is great. But that also leaves a whole lot of appointments that are there for patients to use so that they can get access to their providers that they otherwise would not have. So we think that's, important for multiple reasons. One, it does help the patient get in quicker. There's more appointments available. It doesn't impact the workflow within the practice because it has a very high accuracy of predicting what patient's not going to show. So you open up a double book slot, that slot gets used. The original patient doesn't show up 80% of the time, and then you have that slot filled. So that's been really good. We've also worked to expand it really at a client's request to help with scheduling post-discharge follow-up appointments for patients from the inpatient side. So the way that works is it actually was a client that came up with this idea in the inpatient side. The case managers were having problems with first with patients not showing up for their discharge, their post-discharge follow-up. And that leads to readmissions and all kinds of other complications. What they wanted to be able to do to say, okay, if you can predict that this patient's not going to show the ambulatory side, we book an appointment. We want to know that. So now they can come up with other ways of dealing, give a high personal touch with that patient. Maybe it's better to schedule a telehealth visit that they're more likely because they may have transportation issues, or maybe you schedule a home visit instead. So you can intervene and make sure that patient gets that appointment. And then for the ones that have a high likelihood of actually showing, then we created a automated process between the inpatient EHR and the ambulatory EHR, where those patients automatically get fed over to the clinic scheduling department of where they need to visit, and a scheduling request gets dropped into that scheduler's inbox in our EHR. So you're able to improve that access, give the patients better care, and you have better results.
Later this year, we're going to have a strategic partner of ours discuss their machine learning solution for nursing practice decisions. I'm wondering if you could talk a little bit about your thoughts around AI use in nursing practice.
Yeah, I'm interested to hear that one. That should be very informative. One of them we just talked about, which was really around case management and getting those post-discharge follow-up meetings scheduled. That's really based on predictive AI, using predictive AI to identify these patients and then the best way to get them scheduled. But there's probably a lot of other stuff going on the generative AI side. So they can be used for, clinical notes. There's a lot of tools out there for communicating with patients using the generative AI, analyzing and entering conversations between the clinician and the patient, and that goes directly into the EHR. There's a lot of exciting stuff going on in that space. You can also suggesting clinical care, clinical documentation. You can streamline writing an appeal for denials. I think there's just a whole lot of opportunities to use it on the nursing side.
Where do you see BRG positioning ourselves to meet our clients' needs as this emerging technology evolves?
We're in the business of helping health systems improve performance. That's what we do. We think there are many opportunities to apply AI and automation tools that can help streamline processes and help drive efficiencies. We've only just started on developing and implementing these tools. It's only been about a year and a half or 2 years, and we've seen some great progress and some great results. And some of our best ideas, like I talked about with the case management, they come right from our clients. They see some of the tools being used successfully in one area, and they suggest other problems that can be solved. So we can help them develop these customized solutions and these customized tools that can be used again to solve specific, well-defined problems. And then we can see the impact on this both financially and as it relates to patient care. For the no-show tool, besides opening up all those new appointments to get patients in faster, you're also developing a lot of new revenue. For one client, the first year was almost $1.5 million in new revenue just from patient visits and new visits. And I think another way that we help our clients is that we work with so many hospitals and we're exposed to a lot of applications that are being used in our various clients. And we see them firsthand. So we understand which ones are providing value and maybe which ones aren't providing so much value. We know how much they cost. Are they worth the benefit, that the ROI that you're getting? And vendors are out there, they're rushing to sell their solutions and capture market share. So we can work with our clients to help them develop a center of excellence so that they can weed through these thousands of applications that are out there and decide upon which ones will work the best for them, both from our experience in putting together a formal process for evaluating these, and also taking into account some of the concerns around data privacy, data accuracy, and so forth.
Any closing thoughts as we wrap up this episode?
Sure. There's a lot of great uses for AI in healthcare in the provider space. And I think it's a really exciting time for that. If you're a newcomer to this space, I think it's important to get a good understanding of what AI is and its uses. For example, what's the difference between predictive AI and generative AI? What those uses are for each. And also understanding the concerns around the data privacy, the accuracy, and data integrity. So be very thoughtful about where and how you plan on implementing these solutions.
Our topic today was AI and the future of healthcare. BRG's complete report is available for free download using the link in this episode's description. Paul, thank you so much for your time today and sharing this with our listeners.
Thanks for talking to me.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.